Today, we're going to tackle some hard critical reasoning strengthening questions, and I'm going to show you a bunch of tricks and tips along the way. I also have a free bonus for you. 3 GMAT myths that are holding back your score. When you understand how the GMAT actually works instead of how everyone thinks it works, your score is going to go up a lot, I promise. This is yours completely free. You can download it right in the description. Okay, let's go ahead and tackle those critical reasoning questions. The secret for nailing strengthening questions is really pretty simple. First, pull out the conclusion, because we always pull out the conclusion, and then ask yourself which answer choice makes the conclusion most likely to happen. We're looking for reasons why the conclusion will be successful. When you're looking for the conclusion, you're looking for what you want to have happen. It's the goal or the prediction or the preferred outcome. Write down the conclusion in a single declarative sentence and do not start with the word because. The evidence is why the conclusion will happen or how the conclusion will happen. Some people think of it as the mechanism for making the conclusion happen. The idea is the conclusion must be right because of this. So the argument is some variation of because of this evidence, the conclusion must inevitably be correct. Now it's best to write down both the evidence and the conclusion. All right, let's do an example. This is a bit too long to read out loud, so go ahead, read it on your own, and then we'll dive in. Okay, first, what is the conclusion? What's the goal? What is it we're trying to do? Well, we want to reduce costs. Okay. Why are the costs going down? How are they going to achieve that? Well, they're going to eliminate the review panel. So the argument is if they eliminate the review panel, that makes costs go down. Now we're asked to strengthen that argument, so we need a reason why eliminating the review panel will make the costs go down. Okay, let's look at our answer choices. All right, first off, A is out. And A is out because it doesn't have anything to do with cost, doesn't even mention costs. A can't be right. What about B? Well, let's think about this. B actually goes the other way. B is saying that sometimes doctors do prescribe these unnecessary treatments and that the review panel wouldn't have allowed them to do that. B is a reason why costs would go up when you eliminate the review panel. We need a reason why costs would go down. B is out. Now C looks good. C says that, you know what, that review panel on its own is expensive to run and it rarely catches wasteful procedures. So if we eliminated it, we wouldn't have to pay for it anymore and it doesn't really save us much money anyway. Okay, we keep C around. D, no, D again doesn't even touch on costs, can't be right. For E, you see, we don't need to know exactly how the review panel works. We just need a reason why getting rid of it would lower the costs. E doesn't help us, so our answer is C. This is a bit too long to read out loud, so read it to yourself and then we'll dive in. Okay, first, what is the conclusion? What's happening? Well, apparently there's an increase in percatix-resistant infections. All right, fine. Why is it happening? Well, it's happening because patients aren't taking the medication as prescribed. Now, we're being asked to strengthen or support that argument, so we are looking for a reason why patients aren't taking the medication as prescribed. Okay, let's check out the answer choices. Well, A is out. We don't care about other antibiotics. The argument is very specifically about percatix. What about B? Well, B is out too. We're looking for a reason why patients aren't taking percatix as prescribed, and B doesn't offer us one. What about C? Well, C is out. C at least mentions percatix, but it doesn't give us a reason why a patient wouldn't use it as prescribed. What about D? Well, you know what? D is a possibility. So apparently a lot of patients get very severe side effects earlier in their treatment. That could totally cause them not to keep taking it. That would be a reasonable reason why they wouldn't take it as prescribed. We'll keep D around. What about E? Well, E doesn't really help us. E basically says that percatix is cheap. Well, that's great, but we need a reason why patients might not take it as prescribed. The only answer choice that gives us a reasonable reason why patients might not take it as prescribed is D. D is our answer. So remember, whenever you're being asked to strengthen an argument, you're looking for reasons why the conclusion will actually happen, why the prediction will come true, why the goal will be achieved, or why the plan will succeed. Okay, great job. That's how it works. When you're strengthening an argument, you're looking for some reason why the conclusion is more likely to happen, some reason why the plan is more likely to work. All right, good work. We'll see you next time.